The project that we have funded through the Patient-Centered Outcomes Research Institute is methods for prioritizing surrogate desired outcomes for patients. And so what that really focuses on is actually the caregiver and how they prioritize the risks and benefits of treatment and outcomes for a patient in their care. So when we started on this proposal, my work had primarily been on children with mental illness and working with families of children with mental illness. And so Bev very adamantly said, you have to look at children with intellectual disability and mental illness because these are our most vulnerable patients, and they're the kids that actually fall through the cracks in the treatment services that are available in the community.
We engaged families, we did in-depth interviews, we had focus groups, and they actually listened to what they had to say. So we learned what was important to them, and we learned also what their challenges are. And from this, in my layman's terms, we developed all kinds of scenarios and levels and things that we should think about, and they developed a survey from that. That is very layman. But we got that from the families. We didn't pull it out of thin air. We didn't read it in a textbook. We got it from what's important to families. It is my privilege to work with a dedicated team of researchers and students who really want to help caregivers. They want to take this work to them so that it can help them make better decisions. I don't know if you have friends or have ever experienced raising a child with mental health issues, but you're always on an emotional roller coaster. It is never easy. So we're hoping that this research will help make it easier for folks. We're also hoping that they can understand that there is going to be a positive outcome and that they can remain hopeful, because sometimes that is very difficult, because you have this person talking in your ear, you have the school calling you saying you got to put your kids on medication. You have a family saying, oh, you can't medicate your kids. You just don't know what to do. So we're taking this research and hoping to make it a lot easier, and at least so families will have something to think about.